Welcome to the deep dive. Today we're taking what feels like a really necessary and frankly urgent look at something that's a cornerstone of local healthcare.
Your community pharmacy.
Exactly. We're doing a deep dive into the intense and, from what we're seeing, completely unsustainable pressures that pharmacies are facing all across England.
And we're basing this on some really solid data. This is from the Community Pharmacy England's 2025 Pharmacy Pressure Survey.
Yeah, this isn't just a few stories here and there.
No, not at all. Our mission here is to really get past the headlines. We're looking at responses from owners who represent over 4,300 pharmacy premises.
Wow.
And direct feedback from more than 1,600 staff members. I mean, this is the voice of the sector, loud and clear.
Yeah, and that voice is, well, it's telling us the system is fundamentally stressed. Before we even get into the money or the operations, we have to start with the people, the ones showing up every day. Because the first statistic is genuinely devastating. Nearly 7 out of 10 pharmacy staff, that's a massive 70%.
70%.
A report that these pressures are having a negative impact on their mental health and their well-being.
That's 70% figure. It's the clearest sign we have that this is a human resources crisis that's just, disguised as a funding problem.
Right.
When you have nearly 3/4 of your workforce saying their job is actively harming their health, the whole sector's future is in question.
It really makes you wonder how people are even managing to keep going, doesn't it? Because the report shows that a quarter of pharmacy teams, 25%, are admitting they're now barely coping, or even more alarmingly, not coping at all.
And this is where you connect the stats to the real world. It's not just the staff. The pressure hits the owners and managers the hardest.
Because they're the ones ultimately responsible.
Exactly. They feel this personal duty to keep the doors open. We saw some extraordinary anecdotes in the source material. Owners talking about working 15-hour shifts.
15 hours.
One owner specifically said they have to go in every single Sunday just to get through the paperwork, and then admitted, and this is a direct quote, "In reality, I do not have a life."
That isn't a job anymore. That's just pure self-sacrifice to fulfill an NHS contract. And this pressure, it just feeds itself, creating this awful cycle.
A vicious cycle.
Yeah, we see it in the data for staff shortages. 32% of shortages are linked directly to sickness.
Right. So staff get burned out from the stress. They have to take sick leave, which means the people left have to pick up the slack.
Which makes them more stressed.
And causes more sickness. It's a classic downward spiral. And the current model just seems totally incapable of breaking it.
And there's also this conflict between morale and dedication, isn't there? I mean, these people are obviously dedicated. That's why they're still showing up.
Oh, absolutely. They say they feel really valued by their patients, by their community.
But that dedication gets worn down. They feel completely underappreciated, undervalued by the bigger system they work for, by the NHS.
That gap,
Yeah.
being loved locally but feeling ignored centrally, that's a huge driver for burnout. But let's maybe shift gears a bit and see how that burnout affects the day-to-day, the operational crunch.
Yes, because that strain on the people, it inevitably becomes a strain on the actual pharmacy and its ability to serve you. The data here is pretty overwhelming.
It is.
We're talking about a majority of pharmacies struggling. Over 60%, 64% to be exact, of teams reported they're experiencing staffing shortages.
And that's where you see the most direct, the most painful impact on the community.
Yeah.
Because if you don't have enough qualified staff,
You can't open.
you can't open. The report states that over 1 in 5 pharmacies, 21%, have had to temporarily close their doors as a direct result of not having enough people.
1 in 5. I mean, just stop and think about that for a second. If you rely on your local pharmacy for a regular prescription, there's a real chance you could turn up one day and the doors will just be locked.
Because they simply couldn't get a pharmacist in. And the problem isn't just keeping staff, it's hiring them in the first place.
The recruitment challenge.
A huge challenge. Over half of pharmacy owners, 54%, say they're struggling to recruit permanent team members. For pharmacists specifically, it's 37% reporting difficulty.
So if you can't find new people, you have to make some tough business decisions. This is where the cost pressure just becomes suffocating. A staggering 57% of owners have just stopped recruiting.
They've given up trying to fill vacancies.
Yes, over the past year, they're choosing to shrink their own capacity because they can't afford to bleed money trying to find people.
Which brings us to the locum issue. We should probably just quickly explain what a locum is.
Good idea.
A locum is basically a freelance pharmacist or technician. They're hired to fill gaps, often at the last minute. They're meant to be a temporary fix.
But they've become a permanent and very expensive problem.
A massive financial drain.
Yeah.
When you can't hire permanent staff, You have to rely on them.
Yeah.
But the cost is. It's punishing. It can be over 40 pounds an hour.
And that damages the patient experience too, right? Because you lose
Mhm.
that continuity. You don't see the same friendly face every time. You lose that trust.
It all comes back to the same root cause, the lack of money in the system. So maybe let's dive into those underlying financial pressures now.
Yeah, let's do that. When staff were asked what the main drivers of pressure were, three things really stood out. First, just the sheer workload. 88% cited heavy workload.
And that's up from 78% just 2 years ago. It's getting worse,
Much worse. Second, and this is so disruptive for patients, is the problem sourcing medicines. 80% of staff cited that.
which has also gotten worse since 2022. And you can imagine how stressful that is. You've got a patient right in front of you. They desperately need their medication.
And you're on the phone for hours trying to find it because the supply chain is a mess.
Exactly.
And the third, the big one, cited by 61%, insufficient funding. This is the financial black hole we need to get our heads around, is the core issue, essentially, that the NHS contracts just haven't kept up with reality.
That's it, precisely. The funding has been, in real terms, either fixed or cut for years. Meanwhile, all their costs, staff, rent, utilities, have just soared with inflation.
The numbers just don't add up.
They can't. Running the business according to the contract is basically financially impossible now.
And the proof is in the owner's own personal finances. It's devastating. Nearly half of them, 48%, say their staffing costs alone make their business model unsustainable.
And to really understand how dire it is, look at what the owners are paying themselves.
Or not paying themselves.
Exactly. The data shows over 60% of owners or directors have taken no salary or income from their own business.
Let that sink in. They are running a critical healthcare service for free.
It's worse than that. Over half, 51%, have had to prop up the business using their own personal savings. They're draining their retirement funds just to keep NHS services running in their town.
That's the internal strain. But then there's the external pressure, too. On top of all that, the report shows that more than half of pharmacy staff, 54%, report experiencing abuse from patients.
So you have this awful dynamic. The pharmacy can't meet demand because they don't have the staff for the medicine.
And the patients get frustrated by the delays. We know 81% report longer waits now.
And they take that frustration out on the staff. So you're burning out from the workload, and then you're getting aggression from the very people you're trying to help.
It's just an impossible situation. And when you combine all of that, the financial strain, the human cost, the inevitable result is that patient care suffers.
It has to. We've already mentioned the 81% longer wait times, but what's really worrying is the loss of proactive care. 57% of staff say they have a reduced ability to just offer advice and other services.
Which means essential things are just disappearing. A third of pharmacies, 33%, have had to stop providing some of those non-essential but often vital services.
Things like blood pressure checks, maybe, or vaccination clinics.
Exactly. Things they used to do because they just don't have the time or the staff to run them anymore.
And on top of that, nearly 1 in 5, 18%, have had to cut their opening hours.
Which, if you live in a rural area or work long hours yourself, could be the difference between getting your medicine and not.
The ultimate tragic end to all this is permanent closure. The report highlights the case study of Timotop Awafeso in Kent. He had to permanently close his pharmacy.
And his pharmacy was award nominated. That detail is so important.
It's critical because he confirmed it wasn't about bad service or failing standards. It was purely because the funding model was so unsustainable, he just couldn't subsidize it anymore.
When a business that is, by all accounts, excellent can't survive.
Right.
That tells you the model itself is broken.
It really does. And the forecast from the industry is just grim. Looking ahead, 1/5, 21% of pharmacy owners say they don't expect their business to survive another year.
That number. It should be a massive red flag for NHS leadership. If 21% of pharmacies actually close, the knock-on effect for GPs and hospitals will be, well, catastrophic.
So what's the ask? What do they say needs to be done?
Well, Community Pharmacy England and Pharmacist Support have laid out some clear recommendations. The main call is for increased community pharmacy funding.
Which isn't just, a plea for more money for its own sake.
No, it's very specific. They need funds to support recruitment and retention.
They need to be able to compete, right? They're losing staff to better funded parts of the NHS, like hospital pharmacies, that can just offer better pay and conditions.
Exactly. They also need better workforce support. They're asking for the NHS to give them protected learning time for training.
Which other primary care providers like GP practices already get.
Right. It seems only fair. Professional development shouldn't be something you have to squeeze into your one day off after working a 15-hour day.
And finally, there's a big push to let them use the skills they already have. They want funding and support for pharmacists to work to the top of their license.
Which basically means letting highly qualified pharmacists use all of their clinical training instead of just dispensing pills.
So funding for them to become independent prescribers, for instance.
Yeah.
So they can assess and prescribe for common illnesses, taking a huge amount of pressure off GPs. They want to be part of the solution.
But they need the system to support them to do it.
Absolutely.
Yeah.
Talent and the will is there, but the capacity is just gone.
So let's just quickly recap the key takeaways here. The core issue is that chronic underfunding.
Translates directly into a massive human cost, with 70% of staff saying their mental health is suffering.
And that stressed out workforce, facing burnout from inside and abuse from outside, leads to a definite degradation of service for the whole community.
With 81% reporting longer waits and essential services being cut, the commitment is there from the people, but the system's capacity has collapsed.
Which leaves us with a final thought for you to consider. If these trends continue, and 1 in 5 pharmacy owners really do expect to shut their doors for good in the next year, we're not just talking about losing a local shop.
No.
We're talking about losing immediate local access to healthcare, to medicine, to vital advice for millions of people. So the question is, what price will the entire healthcare system pay when the easiest, most accessible front door to care just disappears from our high streets?
When that local pharmacy goes, the whole community health system takes a hit. And the already strained GP surgeries and hospitals, they won't be able to absorb it. It's just an unsustainable path.
Something critical to think about. That's all the time we have for this deep dive. Thank you for joining us.